If we could please stick to the times allocated. Hello. My name is Dr. Dilek Sarıkaya Varlık. I work at the Kırklareli State Hospital. Previously, I worked in Rize Kaçkar as part of my compulsory service. Today, I'll be talking about thyroid functions in the elderly and effects on mental state. According to the Turkish Statistical Institute data, as of 2015, the ratio of the population over 65 years of age in our country to the total population is 8.2%. By 2050, the same rate is expected to go up to 17%. So, all in all, it's an increasingly aging society. We see many news in the media that Rize is the second city in Turkey in terms of highest average expected life. Let's see why. Rize's geographical conditions can be quite challenging, but it has a high level of oxygen and clean air. There are some age-related changes. For example, each organ system function declines at different rates. We also know that 75% of the elderly have at least one disease. Neurocognitive deficits are seen in increasing intensity as interdisciplinary medical problems in middle age and advanced age patients. Back to Rize again. This was in the news 2 years ago. This is the imam in a village. He said the prayers 10 minutes too early. Sometimes there are these cognitive problems with regards to age. What about thyroid gland? Thyroid hormone concentrations vary with age. Symptoms may be confused with normal aging process specification. There might be some additional diseases, there might be multiple medications used, and these might mask or mimic the presentation of thyroid disease, especially in elderly women. Hypothyroidism and subclinical hypothyroidism should not be missed or overlooked because it's a very important point in terms of depression. What are some other age-related changes? Most of these show similar results. We see that serum FT4 levels remain unchanged. Serum thyroid stimulating hormone TSH comes down. Serum FT3 comes down. Particularly for females over the age of 60, we see that anti-TPO, anti-TG goes up, and there is some prevalence of subclinical hypothyroidism. Fasting, malnutrition, acute and chronic illnesses are associated with a decreased serum T3 and increased RT3 without any evidence of thyroid disease. This is often referred to as a non-thyroidal illness. It's an important confounder in the assessment of thyroid function in the elderly. Use of medication may influence thyroid function. Tests in the elderly. Drugs can cause lithium because of its relation to hypothyroid, but there are also some other factors that must be considered in interpreting altered thyroid function tests in the elderly. Because of all the above reasons, we need to be very careful about this situation. Let's look at the frequencies of hyperthyroidism in the elderly. Frequencies range from 0.5 to 3% in populations older than 60 years of age. Toxic multinodular goiter is the most frequent cause of spontaneous hyperthyroidism in the elderly in areas with a low iodine intake. Graves' disease is more common in areas where this can be observed. There are also fewer signs and symptoms of hyperthyroidism in elderly. They often lack a tremor, heat intolerance, ocular signs, nervousness, or tachycardia that might be more frequently seen in younger populations. The frequency of atrial fibrillation is higher. There might be unexplained weight loss with diarrhea, but also with constipation. Nausea and vomiting may be the dominant picture in the elderly, which are sometimes difficult to associate with hyperthyroidism. What matters for us is to consider agitated depression or mania or anxiety, because these can be manifestations of hyperthyroidism in the elderly, and administration of 131L is important. Hypothyroidism in elderly, prevalence is up to 5% in subjects over 60 years of age. Hypothyroidism in the elderly is often atypical. This is due to a more insidious onset, the coexistence of several age-associated diseases, and the notion that several signs and symptoms like fatigue, cold intolerance, constipation, congestive heart failure, depression, etc. may be attributed to the process of aging itself. The most frequent cause is autoimmune thyroiditis, followed by prior therapy for previous thyrotoxicosis. Treatment, thyroid hormone replacement therapy. For treatment, the replacement therapy is used. Subclinical hyperthyroidism in the elderly can be observed by low serum TSH combined with FT4 and FT3 in the reference range. Especially in the elderly, other causes of a low TSH, such as non-thyroidal illness, fasting, malnutrition, administration of drugs, should be excluded before making the diagnosis. With a prevalence of 3.2%, 2% after the exclusion of subjects with non-thyroid disease, 20.44. The link between autoimmune thyroiditis and aging is illustrated by the high prevalence of subclinical hyperthyroidism with positive autoantibodies in the elderly. Subclinical hypothyroidism is defined as an elevated TSH combined with a normal FT4. The frequency of subclinical hypothyroidism varies from 4 to 8.5% in different populations, and increasing frequency in older subjects. In women aged 60 years and older, subclinical hypothyroidism may be present in up to 20% of the cases, and in men up to 8%. The prevalence is lower in blacks than in whites, in women over 80 years of age, and in populations with iodine deficiency. If the TSH is below 10 mu and if the FT levels are normal, current guidelines do not recommend routine thyroid hormone substitution. Thyroid function tests with a 6 to 12 month interval are recommended to monitor the course of the serum TSH level. In patients with TSH above 10, therapy can be considered as reasonable due to the high progression rate to avert hypothyroidism. This is especially true in women over the age of 60 who have positive antibodies. Why are thyroid functions important in psychiatric practice? First of all, we know that both for hypo and hyperthyroidism there might be acute psychiatric episodes. There might be resistance depression. We also see that there are effects of psychopharmacological agents on thyroid function. These are first level medicine that we use, but we also need to consider the fact that female patients with rapid cycling might experience bipolar disorder. We need to assess thyroid functions for this type of patients. In many examples of the literature, this is an important point that we need to pay attention to. The possibility of comorbidities in treatment-resistant depression and the use of thyroid hormone preparations in treatment are always important for us. And In the guidelines, HRT and preparations are recommended, suggested. We see in the recent years there are some studies on older age groups which have focused on investigating the effects of subclinical thyroid dysfunction on mood and cognitive functions. And there might be some effects on mood as well as cognitive functionalities. So the subclinical thyroid dysfunction and depression, can we talk about a relationship as such? Well, there are some conflicting findings. If you look at the research done in the last 10 years, we see that there are conflicting findings in some cross-sectional studies that subclinical hypothyroidism and subclinical hyperthyroidism may be related. For example, in a trial with 323 participants over the age of 60, we see that subclinical hypothyroidism was defined as a risk factor. In a South Korean study over the general population with 13,017 patients aged between 70 to 84 years, the risk of depressive symptoms increased in women with high TSH levels, but this finding was not valid for men. When we have a look at broader studies, it's not entirely possible to say the same thing. For example, in a study conducted in Norway with 30,589 participants aged between 40 to 89 years of age, subclinical hypothyroidism or subclinical hyperthyroidism was not deemed to be a risk factor for depression or anxiety. In a study conducted in 2011 with 5,865 male patients over 65 years of age, it was stated there is no correlation between subclinical thyroid dysfunction and depression. In another study in Finland, there was no correlation between TSH, FT4 and FT3 levels and depressive symptoms. In a study conducted in Finland, in a 3-year follow-up study with 606 patients aged 70 years and over, published in 2016, it was found that there is no relation between subclinical hypothyroidism and depressive symptoms, but there is a relationship between subclinical hyperthyroidism and depressive symptoms, and further work was needed. When we look at the literature for any studies undertaken in Turkey, particularly extensive studies with a high number of participants, unfortunately that's not possible. Maybe that's a direction for us going forward. Let's have a look at the subclinical thyroid dysfunction and the cognitive functions. The question is whether subclinical thyroid dysfunction a risk factor for cognitive decline. Literature actually findings are quite inconsistent. Some studies indicate that low serum TSH levels are associated with cognitive impairment or dementia. Some have no association, and some have high serum TSH levels correlated with low working memory performance. I'll give a few examples. This is from the year 2000. N is 1,843 over the age of 55, followed by 2 years. The first study to suggest that subclinical hyperthyroidism in the elderly increases the risk of dementia and Alzheimer's disease. When we look at other studies, for example, this one was undertaken over the general population, age range 23 to 102, increased rate of thyroid dysfunction with age. Another study over the age of 65, undertaken in Brazil with 1,276 participants. In men, subclinical hyperthyroidism is positively associated with all subtypes of dementia. However, there is no such relationship for women. Regarding studies looking into whether subclinical thyroid dysfunction in the elderly associated with depression, Another example, this time from the UK, with 5,868 patients from 2006 between the years of 65 to 84. There was no significant relationship between thyroid functions and cognitive functions, depression, and anxiety levels. Smaller scale study with 19 female patients with L-troxin treatment. The age range was 20 to 75. They were compared with an NPT battery. Most of the patients were over the age of 65. It was found that high serum TSH levels, subclinical hypothyroidism, were associated with poor performance in working memory tests of these patients. So, subclinical hypothyroidism is normally associated with dementia. However, this was an outlier as such for patients on NPT battery. Another example where the mean age of the participants was 75. It was a 12-year follow-up study. This is a very frequently referenced study. There were a total of 1,864 participants. Low and high TSH levels are associated with an increased risk of Alzheimer's dementia in women. So low levels and high levels might increase the risk of dementia, but there is no such relationship in men. This is a conflicting result compared to the other study that I have mentioned. A South Korean study, 495 patients over the age of 65 years. There is a relationship between low serum TSH levels, below 0.5 mLu per L, and cognitive impairment. However, it was stated that there is no relationship between serum TSH levels and depression. Let's have a look at recent studies. What do they say? In a systematic meta-analysis published in 2016, it was noted that subclinical hyperthyroidism may be associated with a moderate increase in dementia risk, but no association with subclinical hypothyroidism. This was a meta-analysis of 11 retrospective studies. This is the Rotterdam study, a significant study that was published in 2006. 8 years follow-up, 9,446 participants, mean age 65, 601 cases of dementia was observed. Subclinical hypothyroidism was associated with low risk of dementia. High FT4 levels was associated with high dementia risk, and higher TSH related to better global cognitive scores came out of this study. In the same study, a very important point, old women with a high TSH level, it was observed that 10-year absolute dementia risk falls from 15% to 10%. This is not the case for men, only for women about the age of 65. This is from 2017, a Mexican study. MMSE test was applied for patients over the age of 60 years. Clinical and subclinical hypothyroidism has been shown to be associated with poorer cognitive performance in the elderly people. So, to wrap up, we could say that recent studies with elderly have focused on the neuropsychiatric reflections of subclinical thyroid dysfunction. The findings are contradictory. There is no expansive studies undertaken in Turkey. Maybe that might be the case going forward. Subclinical thyroid dysfunction has no significant relationship between anxiety and depression. Subclinical hyperthyroidism points to an increased risk of dementia. Subclinical hypothyroidism, particularly in women, can be associated with a reduced risk of dementia. Thank you for your kind attention.